Hello students, welcome to the channel. So today in this video we are going to cover some questions with their brief explanations, which is very important for your competitive exam. So here we have a first question is, which city is recorded as the most polluted megacity in the world by World Health Organization? And the options are, option A is Beijing, option B is Delhi, option C is Cairo, option D is Hong Kong. So which city is recorded as the most polluted megacity in the world by World Health Organization? So the correct answer is Delhi is recorded as the most polluted megacity in the world by World Health Organization. So let's discuss with the help of explanation part. That the World Health Organization survey named New Delhi as the world's most polluted big city, and other polluted megacities with their populations over 14 million include, that is Cairo, Dhaka in Bangladesh, and Mumbai in India, and last one is Beijing. So New Delhi is the world's most polluted big city. So it's all about this question. Moving on the next question. All of the following are the therapeutic uses of penicillin G, except we have to find out that which is not the use of penicillin G. Option A is bacterial meningitis, option B is rickettsial infection, option C is syphilis, option D is anthrax. So which is not the in which the penicillin G is not used? The correct answer is rickettsial infection. Penicillin G is not used in rickettsial infection. So let's discuss in explanation that penicillin are used for listeria, actinomycosis, as for syphilis, tetanus, meningococcal meningitis, anthrax. So just with the help of this trick, that Plastman, P-L-A-S-T, Plast, M-A-N, Plastman. So penicillin, the trick is used to learn a Plastman. So it's all about this question. Moving on the next question. Total number of purine nucleotides is equal to total number of pyrimidine nucleotides. This is according to options are, option A Watson and Crick model, option B is Bohr's effect, option C is Chargaff's rules, option D is Argon rule. So total number of purine nucleotide is equal to total number of pyrimidine nucleotides. This is according to which scientist or which rule? So the correct answer is Chargaff rule. The total number of purine nucleotide is equal to total number of pyrimidine nucleotide. This is according to Chargaff's rules. Let's discuss with the help of explanation that it states that DNA from any cell of any organism should have a 1:1 ratio, that is base pair rule, of pyrimidine and purine bases, and more specifically that the amount of guanine should be equal to cytosine and the amount of adenine should be equal to thymine. This pattern is found in both strands of the DNA. So just Chargaff rules mentioned that the base pairs should be in the equal ratio, that is 1:1 ratio, that guanine is equal to the cytosine, that is G is equal to C and A is equal to T. So it's all about this question. Moving on the next question, that a vasodilating compound is produced by decarboxylation of amino acid, and options are, option A arginine, option B is aspartic acid, option C is glutamine, option D is histidine. So a vasodilating compound is produced by decarboxylation of amino acid. Which is the correct answer? So the correct answer is histidine. So let's discuss with the help of explanation that amino acid histidine on decarboxylation produce histamine, which is a vasodilating agent. So let's discuss with the help of this picture that this is the structure of histidine, and with the help of histidine here decarboxylase, with the help of histidine decarboxylase, it converts into histamine, which is a vasodilating agent. So next question is, Taxol is an example of, options are, option A monoterpenoids, option B sesquiterpenoids, option C diterpenoids, option D carotenoids. So Taxol is an example of, the correct answer is diterpenoid, means Taxol is an example of diterpenoid. Let's discuss with the help of explanation. Here we have a chart simple which is showing that here monoterpenoid and isoprenoid, non-isoprenoid unit are limonene, cineol and alpha-pinene, where sesquiterpenoids, that is alpha-methylene gamma-lactone unit, are sandalwood, oil, clove and arnica, where diterpenoids, which is asked in the question, that diterpenoid geranyl pyrophosphate unit are Taxus and Coleus, and carotenoids, that is beta carotene and zeaxanthin, are lutein, cryptoxanthin and zeaxanthin. Students, sometimes the question may also ask from this that which is the monoterpenoid, which is diterpenoid. So try to note down these in your notebook and get revised on time, so it will help you to attempt the questions without any hesitation. Next question is, in gram staining techniques, counter stain used as, the options are, option A is safranin, option B is crystal violet, option C is methyl violet, option D is gentian violet. So in gram staining techniques, counter stain used is, and the option is, which is the correct answer, safranin. In gram staining techniques, counter stain used is safranin. So let's discuss with the help of explanation. Here we have a chart where just mention the gram staining steps, cell effects, gram positive, here gram positive and gram negative. So first step is crystal violet, primary stain added to specimen smear, and what the effect of cell is, stain cells purple or blue, where in step 2 with the help of iodine, mordant makes dye less soluble, so it is adhered to cell walls, and what the cell effect is, cells remain purple or blue, here as it shows in the diagram. And in step 3, alcohol which dechlorizes washes away stain from gram negative cell walls, and what the cell effect is, gram positive cells remain purple or blue and gram negative cells are colorless, as it's we just mentioned in the diagram that here gram positive having the purple color and it is become colorless. And in step 4, the safranin, which is used as counter stain, allows dyes adherence to gram negative cells. So here the effect is gram positive cells remains purple or blue and gram negative cells appear pink or red. So here we have a gram positive which is purple or blue, and the gram negative become pink or red. So it's all about the gram stain process. Students, don't get confused in a gram negative or gram positive and what in their steps. So it's all about this question. Moving on the next question, what is the rank of India in the ranking published by Index of Economic Freedom in 2018? And the options are, option A 105, option B 115, option C 130, option D 135. So what is the rank of India in the ranking published by Index of Economic Freedom in 2018? So the correct answer is 130th rank of India in the ranking published by Index of Economic Freedom in 2018. So let's discuss with the help of explanation that India ranked 130 out of 186 economic in recently released Index of Economic Freedom in 2018 that measures the degree of economic freedom in the countries of the world. So in this edition of index, India with a score of 54.5 jumped 30 places from 143 rank, means India is having previous 143 rank and it jumps to 130th rank. So in previous year 2017 with a score of 52.6 points. So India's rank is 130th. So moving on the next question. Krebs disease is due to the deficiency of. Options are: option A is beta galactosidase, option B is beta glucosidase, option C is ceramidase, option D is sphingomyelinase. So Krebs disease is due to the deficiency of, and the correct answer is sphingomyelinase. Krebs disease is due to the deficiency of sphingomyelinase. Let's discuss with the help of explanation part that Krebs disease, it is also known as globoid cell leukodystrophy or galactosylenchramide lipidosis, and it is a rare and often fatal lysosomal storage disease that results in progressive damage to the nervous system. And KD involves Krebs disease involves dysfunctional metabolism of sphingolipids and is inherited in an autosomal recessive patterns. So Krebs disease is due to this sphingomyelinolysis. So it's all about this Krebs disease. So next question is, here we have just Krebs disease symptoms and the most common form and their frequency. So what are the symptoms? First, that episodes of fever, seizure, still posture, irritability, feeding difficulties, hypertonia or developmental delay or regression, where frequency is means 1 out of 100, means there is a frequency that if some Krebs disease someone having that 1% from out of 100%, and most common form is infantile form. So next question is, choose the number pair group which is different from others. Here we have given our pair is 40-50, and the second one is 30:6, 8:10, and fourth one is 28:35. नहीं है भाई. So next question is, choose the number pair group which is different from others, and the options are here we have just given. One is 40:50, 30:36, third is 8:10, and fourth one is 28:35. So choose the correct option combination, and the options are: option A 8:10, option B is 40:50, option C is 30:36, option D is 28:35. So which is the correct answer? So the correct combination is 30:36. So let's discuss in explanation that how it will be possible. Here the answer is 30:36, and the 40:50, that is 4:5, and 30:36 is 5:6, and 8:10 is equal to 4:5, and 28:35 is to 4:5. So which is the odd one? That is 5:6. So in each of the pair except 30:36, the ratio of the two number is 4:5. So means it is an odd one. Here we have just 4:5, 4:5, 4:5. So these three are same. Which is the different one? 5:6. So the correct answer is 30:36. Next question is, a pregnant female with thyrotoxicosis is planned for surgery. Before surgery can be done, her gland should be reduced in size and vascularity by administering. Options are: option A iodide iron, option B propanolol, option C propyl thiouracil, option D radioactive iodine. So a pregnant female with thyrotoxicosis is planned for surgery before surgery can be done, and her gland should be reduced in size and vascularity by administering. So the correct answer is propyl thiouracil. Let's discuss with the help of explanation that iodides are most commonly used to decrease the size and vascularity of thyroid gland before surgery. Whereas the patient is pregnant, iodides and radioactive iodine is contraindicated, where propyl thiouracil is safe in pregnancy and used for this purpose. So next question is, a person suffering from carcinoma is prescribed a cytotoxic drug which produces neuropathy as the adverse effect. So the drug is, options are, option A is doxorubicin, option B is vincristine, option C is cyclophosphamide, and option D is etoposide. So which is the drug? So the correct answer is vincristine, that a person suffering from carcinoma is prescribed a cytotoxic drug which produces neuropathy as the adverse effect, and the drug is vincristine. Let's discuss with the help of explanation that doxorubicin causes cardiotoxicity, where vincristine causes alopecia, neuropathy, bone marrow depression, and cyclophosphamide causes cystitis, bone marrow depression, where etoposide causes alopecia, leukopenia, and GIT disturbance. So it's all about this question that we have just explained drug wise, that cause cardiac toxicity, vincristine cause alopecia, neuropathy, and bone marrow depression, cyclophosphamide cause cystitis and bone marrow depression, etoposide cause alopecia, leukopenia, and GIT disturbances. So next question is, British anti-leucite ball is name of, and the options are, option A penicillamine, option B dimercaprol, option C deferriprone, option D melarsoprol. So which is the correct answer? So British anti-leucite is a name of dimercaprol. Let's discuss with the help of explanation that dimercaprol, also called British anti-leucite, that is BAL. So it is the medication used to treat acute poisoning which is caused by arsenic, mercury, gold, and lead. So it may also be used for antimony, thallium, or bismuth poisoning, but the evidence for these uses is not very strong. So it is given by injection into a muscle. So dimercaprol is the correct answer. Next question is, distance between two successive maxima and minima is termed as, and the options are, option A is frequency, option B is wave number, option C is wavelength, option D is amplitude. So distance between two successive maxima and two minima is termed as, so the correct answer is wavelength. So distance between two successive maxima and minima is termed as, student, it is termed as wavelength. Let's discuss with the help of explanation. So as it shows that between it's a distance, time distance, and it's an amplitude, and it is a wavelength. So wavelength is the linear distance between any two equivalent points or successive waves, that is maxima or minima, which is the correct answer, and unit says mm, centimeter, micrometer, or nanometer. And the amplitude is the length of the electric vector at a maximum in the wave. And what are the units of this amplitude? Millimeter, centimeter, micrometer, or nanometer. Or third one is frequency, the number of oscillations of the field that occur per second. Second inverse is the unit, and what is the period denotes the time in seconds required for the passage of successive maxima or minima through a fixed point in space, and the unit is second, where the wave number shows the number of waves in a certain distance and it is measured in centimeter inverse. So the correct answer is wavelength. So moving on the next question. Sulfasalazine prodrug after biotransformation releases the following active moieties, and the options are: option A is 5-amino-salicylic acid and sulfapyridine, option B is 4-amino-salicylic acid sulfapyridine, option C is 5-amino-salicylic acid and sulfapyrimidine, option 4th is 4-amino-salicylic acid and sulfapyrimidine. So which is the correct answer? So sulfasalazine, that is a prodrug, after biotransformation releases the following active moieties, which it release. So the correct answer is 5-amino-salicylic acid and sulfapyridine is get released. There is an explanation of this, that sulfasalazine is converted into 5-AS mesalamine and sulfapyridine. So as its structure shows that it is an sulfasalazine, so it's converted into sulfapyridine and 5-ASA mesalamine. So next question is, which of the following was most probably the first metal to be used in India? And the options are: option A iron, option B copper, option C is gold, and option D is silver. So which is the correct answer, and which is the first metal to be used in India? And the correct answer is copper is the first metal to be used in India. So copper is the correct answer. So let's discuss with the help of explanation that the earliest historic evidences of use of metal are Chalcolithic age or stone copper age, which covered the period of from 1800 to 800 BC, before century. This period was marked by the use of copper. So the copper is the correct answer. So it's all about this question. Thanks for watching.